Good afternoon, everyone, and welcome to this 10 Big Steps to Prevent Falls webinar. So we're happy that you can join us for this webinar and hope that you'll be with us for the duration of the week as we have some really great presentations prepared for you and some really great speakers. So my name is Tia Gully, and I am the Falls Prevention Program Administrator here at the Ohio Department of Aging. And as you all know, or hopefully you know, this is Falls Prevention Awareness Week. So thank you again for taking some time to learn more about how you can reduce your risk of having a fall, or how you can help a loved one or someone you're working with to reduce their risk of having falls. So just a couple of housekeeping things. Everyone is in listen only mode. And so as the presentation is going, we encourage you to ask questions. There is a questions box. So you'll see a questions box and also a chat feature. Please use the questions feature if you have any questions that you would like to ask. And so feel free to enter those throughout the duration of the presentation. And at the end of the presentation, we will field those questions and I'll present those to the presenter so that she can answer those questions online for you all. If you have any technical issues or anything like that, feel free to throw those in the question box as well, and we'll do our best to help you through those. All right. So the 10 Big Steps to Prevent Falls is a collaboration between the Ohio Department of Aging Steady You Ohio Initiative and the Ohio Department of Health's Ohio Older Adult Falls Prevention Coalition. So we were very pleased that the Older Adult Falls Prevention Coalition was able to partner with us to bring these presentations to you. The webinars will be made available after the presentation, so they will be online if you have someone that you would like to share them with. And we'd like to thank the contributions that were made from Holmes County General Health District, Ohio Northern University, the Ohio State University Wexner Medical Center, and Select Home Care. So today's webinar is presented by Dr. Shawn Weiss, who is a PT and owner of Select Home Care in Columbus, Ohio, and she's also the president of Senior Health and Wellness Group. She will be talking a little bit more about how to help older adults better understand their fall risk. So again, throughout the presentation, feel free to ask questions, and please join me in welcoming Dr. Shawn Weiss. Shawn?
Great, thank you, Tia, for that introduction. And let me first say that I am super excited and honored to be able to kick off this week's campaign on falls awareness here in Ohio. And as we do with this webinar, and I was just discussing with Tia a minute ago, I'm so used to speaking in a big group of people where I can see all your lovely faces and interact with you. But the Ohio Department of Aging really has put on a spectacular learning opportunity for everybody this week, as you know, each day we'll have a dedicated webinar. And you know, we look at this week to raising awareness here in Ohio during Fall Prevention Awareness Week. And then nationally, we also have a National Fall Prevention Month every September. But really, this topic is near and dear to me because in my field, having owned a home care agency for 17 years and being a physical therapist for 22 years, this topic is at the forefront really on a daily basis. And I would estimate approximately 8 out of every 10 referrals that get called into our agency involve an older adult who has already fallen or somebody that is at a very high risk for falling. So, you know, our team of clinicians really, you know, we are advocates on the prevention and the wellness side of this as well. So that's why I'm super excited to be able to share with you whether you are a caregiver that's helping an older adult, or maybe you yourself has some concerns about falling, or maybe mom or dad or grandma or grandpa are having some significant issues. And this will be a great opportunity for you to take away some concrete things that you can start implementing right away. And you know, let's face it, we are in a critical time right now, especially over the last 8 months. And our overall health and our well-being has been affected. And the aging population in general, really, in my opinion, they're at a greater risk for falling. Thinking about the last 8 months during this COVID-19 pandemic, there are some significant concerns with the negative effects that have occurred while we were trying to protect our older population. You know, there's been increased isolation, there's been decreased activity levels, so people are getting weaker, and we're seeing a greater risk of falls in this population than we have ever before seen. So quality of life is at the forefront right now. So I'm certain that, you know, each of you that is on this call today have been touched, or your family's been touched during the last 8 months. So I really appreciate you guys being on and taking this time to learn about how you can help yourself or help an older adult in your family or community. So what are we going to talk about today? So today we're going to kick off by talking about why this is an epidemic in older adults and why we hear this all of the time. And more importantly, introducing some factors that I'm going to break it down real simple for you that contribute to falls. And there's basically 2 categories that we're going to talk about. And how can you reduce your risk once you learn what those factors are? And then we'll also, as part of step 2 today, look at the risk assessment that you can link to online at the Ohio Department of Aging's website, where you can see what your risk for falls is. I'm also going to show you at the end some nice community resources that are available to you, as well as links to some great websites that have wonderful evidence-based practices for information that you can attain on anytime you wish in your free time. Okay, next slide, Tia. Okay, so let's start by, thank you, back to the very first one that says discussion. Awesome, thank you. So it's important to remember there's a common misconception out there. Falling is not a part of normal aging like a lot of people, say. And I know I've had plenty of contact with people, and even family members are like, well, I'm getting older. It's just a part of getting older. And really it is not. And that's important to understand as we go through today, and understanding what can you do to positively affect and lower somebody's risk for falling. So it is not a normal part of aging. Next, please. So why is it an epidemic? Well, falls are the #1 cause of fatal and non-fatal injuries in the United States for those 65 and older. And here in Ohio, 1 in every 4 Ohioans over the age of 65 are going to fall this year, and an average of 1 every minute in Ohio in terms of falls. So that's really staggering. And let's look at what they did a summary in 2018. In Ohio alone, we had nearly 80,000 emergency room department visits from a fall-related incident. And of those, almost 20,000 people were hospitalized, and we had over 1,300 deaths. That cost Ohioans alone $1.1 billion in terms of the money that is paid out through insurances and out-of-pocket cost. And if you even add, there's some other statistics with Medicare that they did an estimation for the year 2020, and that is this year, and mind you, before the pandemic, that falls-related medical care is going to cost $67.7 billion this year. And again, that was before the COVID-19 pandemic. So this is a really critical time where we can do some things to affect somebody's fall risk. Okay. In conjunction with that, they say that more than half of falls in the older population go unreported. Well, that's kind of funny to read that, because you're like, well, if they're unreported, how do you know, right? Well, we all know somebody. I know people that have not reported a fall. Maybe they don't feel like they were injured, and they're just scared. And we've seen this in so many situations where somebody has fallen and they don't want to tell a family member. Well, why is that? Well, maybe they don't want to burden their family member, and they're scared of having to move out of their own home. Maybe they don't want to go to an assisted living. They don't want to go live with their daughter or son. They don't want to have to go to a nursing home. So these are all legitimate concerns that the older population has in terms of not always wanting to tell us that they feel unsafe. And once that starts happening, once somebody has fallen, sometimes even once, they could develop a fear of falling, and that is a legitimate concern. So what happens when somebody starts falling and they're scared? Then they stop doing things. They stop going out of the home as much and going out into the community. They don't want to do the normal recreational activities that they love to do. So that kind of starts this vicious cycle where decreased activity leads to weakness and decreased endurance and decreased strength. And that in turn obviously will increase somebody's risk for falling. Next. So the big bulk of what we're going to talk about today is really about what contributes to somebody's fall risk. And even as a home care agency and therapist, I teach our therapists this, and I've taught many people in the community this, because it's an easy way to break it down. Because sometimes you're like, where do I start? How do I know what I can affect and what I cannot affect? So what we're doing is we're breaking this down into what's called extrinsic factors and intrinsic factors. And your extrinsic factors, if you remember, starts with an E. They're your environmental factors, things in your home, things in your environment that could be causing your risk to be higher. Intrinsic factors are medical conditions. Those are your diagnoses, all of your medical history, the medications that you're taking. And those are sometimes more difficult to control or make a change with. And we're going to talk about both of those in depth right now. Okay, so we're going to be spending a great deal of time on this slide because this is critical, and I'm sure that each one of you already is going to have your wheels turning about maybe yourself in your situation or a parent or a grandparent that is having issues. So let's look at the intrinsic factors that affect fall risk. This by all means is not an inclusive list. In fact, I'm going to add a couple more before we get off of this slide, but these are the really big ones. The first one is pathway clutter. So let's stop and think about your home. I want you to think about what rooms do you have to access frequently throughout the day? Is it the living room to the kitchen to the bathroom? Is it one main floor of your home? But what does that pathway look like? We want to make sure, and even as therapists, that's kind of what we're trained to do, is to look at the what areas are accessed the most. We don't want things or boxes in the way. We don't want narrow pathways from one point A to point B. So take a look at the areas that you need to be in and making sure that you are clearing out so you have enough room to get through, especially if you have a walker or any type of assistive device. You want to make sure that the pathways are clear. In the bathroom, 80% of all the falls that occur in the home occur in the bathroom, and that's not hard to believe. And you think about this, if you are living alone, the people that are over 65, the bathroom is slippery, and maybe their home is not set up appropriately. They might have a tub that they have to step into. They might not have grab bars installed anywhere, and maybe they're grabbing onto a shower curtain rod or the toilet to get in or what have you, and then stepping in and out of the shower. Are the rugs secure? Are there even rugs at all? Are there mats in the shower? Many things that you can do in this area of the home that can lower somebody's risk. Cords are another big one. Do you have the lamps plugged in? Are the cords out of the way? Is the computer or the printer plugged in? What about phone chargers? What about, like I said, any type of lighting? Making sure those are out of the way of the path. One of the biggest issues that we also face is pets in the home. And this is a tough one. This is something that we have dealt with so much over the last 17 years with our agency, and because pets are family members. But we also see if there are pets, especially small ones, that have contributed to somebody falling, what can you do about it, right? Mom has a dog, and that is it's like a child, and we love our pets. But if there's a pet that's causing a safety issue, what can you do? Possibly are there other areas of the home the pet could be confined to, or that you can interact with a pet in a different manner? These are definitely questions that are hard to approach with somebody who we know the pet is causing an issue in the home. Rugs, you would think intuitively that this is so easy, right? Because rugs can come up and down and roll up and be put away. And if there are any caregivers on the line, I guarantee you that you have dealt with this before. Rugs are so difficult, and I have many, many stories of being, the first to point out that a rug needs to come up, and people are very particular about their rugs and what's in their home. And, the rug matches the shower curtain, that matches the towels, and it's not going anywhere, right? So, we have to look at all kinds of things. How high is the rug? What is the backing like on the rug? Is it slippery? Does it need to be there? Do you have a cane that's tripping over it every time, or is the walker leg catching on the rug? So rugs are a huge factor, and we make as many adjustments as we can. Maybe mom can roll up the rug in the shower and put it in the corner so that her walker doesn't catch on it every time she goes to the bathroom, and it can be rolled out again for her to step in and out of the shower. Those are the types of things you need to start thinking about when you're looking at rugs. And again, something that's easy to fix. Stairs, maybe you're in a 2-story home. Are there railing placements correct? Is there railings on both sides of the stairs, or do you not have railings at all? Do you have to go up the stairs? Is there a way to modify someone's use of going up the stairs where they can be allocated to one floor? Maybe there are steps to get inside the house from the garage. Do we need to put a railing on that because mom is having issues now getting up and down the steps? Footwear is also huge, and we find that, as a home care agency, we find that this one is overlooked quite often, and especially somebody that might have issues with edema or swelling in the feet, maybe diabetes, to where they've had to change their size of shoe, or maybe the swelling is resolved now and their shoes are just too big and they're not fitting properly and they're slipping off of their heel, or they're possibly catching their toe when they walk throughout the home. Make sure you are checking to see that your loved one has the right size shoes, or that you have the appropriate shoes that are not slippery on the bottom, that grandma's not wearing her 2 or 3 inch heels around. And that's a tough one too. I have some great stories about that. And it's a conversation that needs to happen because those are huge contributors to falls. So assistive devices, this is an important topic because we have this discussion so often with our older population who are refusing to use an assistive device. And why is that? How many times have you heard, well, if I have to have a walker, then, you might as well hang it all up, right? It's over. And that's just, the beginning of the end if they have to use an assistive device. And for some, it's legitimately appropriate and needed. And if you're out there and you are thinking about one of your loved ones today having issues, maybe their gait and the way that the way they walk has changed. Maybe they have a wider base of support now and their steps have become shorter and their arms aren't swinging as much and they're hinged forward at the hips. They're leaning forward. So all of those put somebody at a significant risk for falls. And, as therapists, if we assess that and we determine that somebody is appropriate for use of an assistive device, say a front-wheeled walker, and we've determined that that is safe, as soon as you put those 4 points on the ground, right, you have 4 more points on the ground, you are able to have correct posture now. And having that walker allows you to take normal size steps. So in reality, using the assistive device appropriately is lowering your fall risk, and it's actually increasing your quality of life and improving your independence versus taking away your independence. So we have conversations with family members and patients all of the time regarding whether or not they should trial an assistive device, whether it's a cane, a quad cane, a standard walker, a rolling walker. Many things go into deciding what's appropriate for an assistive device. But by all means, having the right type of conversation is the best place to start with that. Safety equipment, we've kind of touched on that already, and that is, especially in the bathroom, there are many great compensation devices now, or adaptive equipment that patients and families can use to help their loved ones be safe. And I'm going to add on to this extrinsic factors list 2 more, and that is lighting. I've been into many a dark home or residential assisted living facility where things are just dark, especially if you have a vision issue. Then you need to check the wattage on the bulbs. You need to make sure at nighttime that the pathway is lit from the bedroom to the bathroom, especially if somebody has incontinence and they are up frequently throughout the night. So lighting is critical. Another topic that's not on this list is clothing. And if you think about people who maybe have a nutritional need, maybe they have lost weight and their pants are not fitting appropriately. Maybe grandpa needs a belt because his pants are going down further to where their pant leg is now dragging the floor. That is something that's very critical. And if you fix that, you have lowered their fall risk by a substantial percentage. So lighting and clothing are something to also pay attention to. So I'm sure that this is getting your wheels turning about how you can look at your home and start pinpointing those environmental factors that you know you need to address in terms of safety. So we can move on now to the next slide for intrinsic factors. Okay, so intrinsic factors is the second area that we can look at in terms of what contributes to falls. Those consist of all of your medical conditions. That is your medical history. And here are some examples of that. By all means, this is not an inclusive list or exclusive list, but macular degeneration or any visual deficits, high blood pressure, hypertension, diabetes, Parkinson's disease, maybe you've had a stroke, maybe you have a respiratory issue such as COPD where you're short of breath frequently when you're up, muscle weakness, especially with inactivity, or maybe you're post-surgical and you have a muscle weakness issue and a pain issue. You could also have chronic pain. You might have neuropathy, and that could be related to your diabetes, to where you have sensory deficits in the bottom of your feet or in your hands where you're not feeling things appropriately. If you've recently been hospitalized or maybe you've had pneumonia, you certainly know what that weakness feels like. Dementia of any type, arthritis, those are just some examples of conditions that will affect your fall risk. I'm going to go back to the dementia list there and cognitive decline. So as we know, dementia really isn't a diagnosis. There are many types of dementia, whether it's Alzheimer's dementia, Lewy body dementia, vascular dementia, Alzheimer's being, of course, the most common type of dementia. But when you are talking of somebody with a memory impairment, or you're starting to notice that things are not the same, to where your loved one is not remembering things as well, then you have to look at a whole set of other factors that we need to address. And we see this so often in the home care setting, especially in residential facilities such as assisted living facilities. I believe the last time I looked at that rate, it is approximately 70% of all assisted living residents have some sort of cognitive impairment. So you can address all the extrinsic factors and the intrinsic factors for sure, but now you have a whole new set of issues of why that person is at a huge risk for falling. You know, the first being their safety judgment is not what it should be. They're not going to also remember recall instructions for their safety. So maybe grandma has a walker and her memory is declining and she's not remembering to always use that walker when she gets up. Well, we're going to need to repeat, right? There's lots of repetition, but I might tell her right now, and then 10 minutes from now, she's still not going to remember to get that walker. So then we have to start looking at, okay, we've adjusted the home environment as best we can, and there's things about her medical condition we're not going to fix, especially with Parkinson's. We know that that is a progressive disorder, and the memory is not going to improve. So what are we going to put in place so that we don't end up having a fall and a hospitalization where that is going to cause significant issues with their quality of life? So maybe we look at supervision at that point. So if you're in a situation and you're listening to this webinar today where maybe somebody in your family or yourself, are not safe to be at home, or we don't have supervision, maybe a family member can go and sit with somebody for a few hours, or maybe we can hire an outside agency to do that. But those are legitimate concerns in somebody with cognitive decline, because you're going to need to repeat those things. Maybe you can put signage up in the home reminding them to take their walker, or of anything that you need to have them. Anything you can do that's going to be a reminder for them, because it's going to need to be frequent. But it often comes down to those with cognitive impairment. The best way to reduce their falls is to increase their supervision. Okay, so other ideas for medications. You're automatically at a higher risk for falls if you take 4 or more medications. And there's going to be a great, again, webinar this week too that addresses solely medications. For example, having a medication review session with your physician, making sure that the dosage is correct. Have you not had it addressed in a few months or a year or more? Are you taking your medications at the right time? Are you taking them at the same time every day? Maybe dad is not remembering to take his medicine every day and he's skipping doses. All of the above can certainly present an increased risk for falling. And as you can listen to the things I'm saying here, you could see why these types of intrinsic factors are more difficult to control, and more difficult to make a change with, because you have to be on these medications, right? You have to be on them to be stable medically because of your medical condition. So there's often things that we're not going to be able to change, but we have to make sure our environment is set up appropriately and that we're educated appropriately in how to lower our risk. Okay. So we've talked about the extrinsic and intrinsic factors. And again, it's a great way to start organizing your mind and what to look for, and start noting down the things that you want to address with you or your loved one. Now, what can you do? Well, we're going to talk about here in a second the risk assessment. And that risk assessment you can link to through the Steady You Ohio website that can be found on the Ohio Department of Aging's website. And that's the same website that you use to register for this webinar. Again, home assessment and modifications. There's going to be even a separate webinar on that this week. Reviewing your medications with your physician, daily exercise. And as a therapist, I could go all day on this one. There are some wonderful evidence-based exercise programs out there for the older population. They are community-based, such as A Matter of Balance. Tai Chi has some great studies that are showing lowering fall risk in the elderly population. The Atego exercise program is one of my favorites because it is home-based. So we do use that a lot in the home care setting. That one has been shown to reduce falls up to 30%. Getting in a physical therapy assessment or an occupational therapy assessment, asking your doctor for a referral for home care. If you're homebound and not driving, you certainly have the opportunity to utilize the home care system and getting an assessment done at a minimum. And that way you can be tested and your environment can be surveyed, and we could see if there's any weakness or balance issues that we can positively affect, maybe with just a really good home exercise program. And let's not forget also nutrition. So how we eat is hugely contributing to our energy levels, how we're feeling, and making sure you have a well-rounded diet that consist of all the food groups, not just, and they're not eliminating certain food groups. Possibly if you have a medical condition such as a cardiovascular condition, are you supposed to be on a certain meal type of program? So those are all the things that we need to think about for sure. And I think let's go through the assessment, the risk assessment that you're going to see. And if you link on this through the Ohio Department of Aging site, what's great about it is you will take this test, and after each question, it will list why that question is important in assessing your risk. So the questions are, one, have you fallen in the past year? And obviously, if you've fallen, you're at a higher risk to fall again. Have you been advised to use a cane or a walker to get around safely in the past? And, think about, have you been advised to, and are you? Those are important things to look at. Sometimes I feel unsteady when I'm walking. I steady myself by holding on to furniture while walking at home. That is a big red flag for us in the home care field of somebody that really truly needs an assessment done and possibly an assistive device. I'm worried about falling, and this is where you have a fear of falling, and we discussed that a few minutes ago. I'm needing to push up with my hands to stand up from a chair. That's usually a sign of weakness, could be leg weakness, to where you just don't feel like you have the strength to get up and down, and certainly that's going to make you more unsteady. I have trouble stepping up onto a curb. This is also a red flag for somebody who has a very high risk for falling, whether they use an assistive device or not. And I often have to rush to the toilet. Maybe you have incontinence, and if you're feeling that you are rushing and you're rushing to get to the bathroom, you're going to increase your risk for falling, especially after dark, if you're not seeing your path appropriately. I've lost some feeling in my feet. Maybe you have neuropathy. Again, maybe your sensation is not very good in the bottom of your feet and you're not feeling your feet on the floor. Number 10 is I take medicine that sometimes makes me feel lightheaded or more tired than usual. Many medications have that side effect, and certainly that contributes to your risk for falling. I take medications to help me sleep or improve my mood. Medications that cause drowsiness sometimes are taken and during the day, and you have to really start paying attention to the appropriate times of the day to take the medication. And I often feel sad or depressed. We're seeing that come up quite a bit right now, especially over the last 8 months during the public health emergency with COVID-19, to where there's just been so much isolation. And again, that vicious cycle that has started with those being depressed or sad or even anxious about their quality of life, about the situation. So those are the questions that will be asked when you click on the Ohio Department of Aging's risk assessment. And they're really important for you to be able to narrow down possibly some things that are putting you or your loved one at risk. Okay, next slide. Okay, so we've talked about the Ohio Department of Aging. There's some wonderful information on that website. The National Council on Aging also has great evidence-based links and even handouts and assessments that you can download and print out as well. The National Institute on Aging is another great resource. The local Alzheimer's chapters, and I know that's not listed on this slide, but it is a wonderful tool. Columbus has a wonderful one. Most large cities have their own council for Alzheimer's, and they are really willing to come out and provide you in the community with resources for your family member, especially those with cognitive impairments. There's also local resources that I believe they will be talking about on the exercise webinar, to where you can link up with the community programs that some of them have started in-person classes again, and some of them are still doing virtual classes, but nonetheless, they could be very beneficial in starting to increase your activity levels if you find that you've not been doing that as of late. So I want to thank everybody for being on here. I hope that this is getting your wheels turning and getting you excited for finding out some more information for the week. And I think, Tia, do we have any questions at all?
No, it doesn't look like we have any questions in the question box, but if you would like to ask a question, again, if you joined us late, there is a question box on your panel, and we invite you to ask a question there, and I can pose it to Dr. Weiss and see if we can get an answer for you. But if you think of a question later, you can always shoot us an email, and we can absolutely address that for you. So I'd like to thank Dr. Weiss for sharing this really important information. So thank you so much for your presentation. And as a follow-up to the presentation, as Dr. Weiss mentioned, we would like to invite you to participate in what is big step number 2, which is to complete the falls risk assessment and discuss the results with your healthcare providers, family, and your friends. And so you can find that assessment on the SteadyU website, which is where you registered at steadyu.ohio.gov. Go to that website, and if you scroll down, you'll be able to find the risk assessment under big step number 2. So we invite you to continue on with these big steps this week and participate in that assessment. Additionally, if you weren't able to join for the entire webinar, or you think that this was good information that would be helpful to share with someone else, the webinar was recorded and will be available on the SteadyU website soon as well. So as Dr. Weiss mentioned, we invite you all to come back tomorrow where we will have a presentation on what is big step number 3, learning about exercising to prevent falls. And that'll be presented by Carrie McQueen from Holmes County General Health District. So again, visit steadyu.ohio.gov to register for that webinar if you haven't already, and you can find out more information about some of the things we talked about today. So again, thank you for joining us, and we look forward to seeing you all tomorrow. Have a good day.